French healthcare has garnered notable attention from the global community. Arising from a rich history of France's journey to better living, the French policies for public well-being sustain large support from citizens and adapt frequently to meet their needs. France has one of the most extensive universal systems, but in contrast to many other forms, heavily protects both patient and practitioner freedom of choice. Furthermore, in 2002, the World Health Organization named France's system the best overall healthcare in the world. In this video, we will examine how the French perspective led to this outstanding achievement. Public social reform and health policy truly began in France during the Third Republic after economic shifts from the French Industrial Revolution brought the middle and lower classes more influence in society. Between 1890 and 1910, the state welfare budget widely expanded to establish bureaucracies to enforce new policies for labor and hygiene, along with the development of insurance. Legislation for national assistance in medical and disease control was enacted in the late 1800s and early 1900s. However, they lacked the organizational components necessary to be effective. The limited extent of reforms at the time can be explained by the strong opposition held by the supporters of laissez-faire policy. In 1945 brought the official institution of France's comprehensive social security system, or what we would refer to as the healthcare system. Social service gained notable attention after the end of World War II in 1944. Hunger and sickness ravaged the population while simultaneously economic production was at an all-time low. Like many other countries, the French were in desperate need of support. The health insurance the system provided significantly swelled the morale of French society, pushing them on to overcome the setbacks of war. The Social Security benefits, in contrast to many other systems, targeted assistance towards the coming generation rather than the aging population. France also decentralized administration of the program, focusing authority in the hands of local representatives, limiting the national government's role. Under the system, medical fees were set at a certain rate, and patients got to choose their physicians, while physicians also retained a choice in who they served. Social welfare in France was stressed as a form of assistance rather than the benefit it is seen as today in the United States, as well as many other countries with strong private sector support. Post-war recovery shifted the French perspective from prioritizing control over the government to providing for France's people. Modern French Social Security retains World War II's values of choice and state benevolence. The system remains at its base very similar, however has extended in coverage and service. When first introduced into French society in 1945, Social Security covered all employed and retired citizens. The self-employed gained coverage in 1966, and forms of support were implemented for the unemployed in 2000. France's Social Security is a universalized national system, but is not considered socialized. The role of the government extends only to pool and direct funds under the Ministry of Social Affairs, Health, and Women's Rights. Additionally, the ministry defines the national health strategy, determining admission rates to medical school and training, the number of hospital beds, and what equipment the state needs. The ministry also sets a fixed price for services, however, physicians retain negotiating powers, enabling them to potentially charge more. Enrollment in Social Security is mandatory. Funding is drawn from taxes, with 53% from payroll tax, 34% from national income tax, and the additional costs covered by levies on alcohol, tobacco, and other industries and products. The effective and successful system racks up a hefty bill amounting to around 11% of the country's GDP. However, the system is considerably reasonable when compared to the 17% of GDP allocated to healthcare in the US. French Social Security accounts for around 70 to 80% of total medical costs. The services covered include hospital care, outpatient care, long-term care, maternity services, diagnostic services, medical appliances, and prescription drugs. Out-of-pocket costs amount on average around 50 euros a year for each individual. Beyond the public sector of healthcare, the country also has a prominent private sector which covers the rest of medical costs. Around 95% of the population also has private health insurance, normally as a benefit from an employer. What distinguishes France's Social Security from socialism is its strong protection of choice, ensuring considerable empowerment of the private individual within the public frame. Patients are able to choose where they receive service, however, in some cases, individuals can choose to abide by government referrals and receive services at a discounted cost. Additionally, doctors retain considerable freedoms. They can choose to be paid on a government-contracted salary or through the state-determined fee per consultation rate. Also, physicians possess the power to turn down patients. The current French system proves capable of sustaining two values opposed to one another in many other countries: individual autonomy and universal public well-being. And in no other place in the U.S. are these seemingly complete contrasts. Privatized insurance dominates the U.S. healthcare system. Like in France, private health insurance is typically provided through employment. However, the U.S. is characterized by an incredibly limited public program. As a result, a large portion of the population is uninsured. In 2018, only 92% of the population had coverage, leaving approximately 27.5 million without health insurance. The U.S. does provide two forms of public health insurance: Medicare and Medicaid. Medicare covers every individual above the age of 65 and others with long-term disabilities. The program provides hospital, medical, and prescription coverage with an additional private insurance option. The Medicaid program is instituted by states and funding is matched by the federal government. Programs cover low-income families and individuals with disabilities, with criteria varying from state to state. The United States protection of the private sector comes at high costs. The typical American pays around $1,800 out of pocket annually. Additionally, the U.S. annual